Welcome back with me, Dr. Aryani, in Holistic Dental Healing Program. Today, we're going to talk about cavity. As I mentioned before, my patients come here always want to know how to keep their teeth for the rest of their life. And as we go through this program, we're going to talk one by one about the contributing factors toward losing your teeth. Number one factor that caused this we lost teeth is actually cavities. I think a lot of people know what this cavity is all about. It's basically a hole inside your mouth. Now, this hole is not normal, and approximately about 70% of adults in US experience cavities, one or two or even more. 40% of children also experience this. How is it possible that there's so many advertisements regarding all of the toothpaste, toothbrush, flossing, all kinds of devices to keep us clean, yet we still have these issues. So it should not to be brushing and flossing. Of course, we need to taking care of that, but there are other factors that contributing toward cavities, and that's what we're going to talk about today. Like I mentioned before, this cavity is one of the most common disease in the world, maybe number one. Now, the cause of that, number one, is biofilm. What is biofilm? Biofilm is like a sticky substance film that attaches to our teeth. Imagine when you wake up in the morning and then you've been sleeping all night and then you didn't brush your teeth, and then when you wake up in the morning you feel like your mouth feel like fuzzy a little bit, and then maybe there's some odor or bad breath come out of that too. So all of this, that fuzzy feeling and then the smell that come out of that is actually called plaque. Okay, so once you brush your teeth, you can feel that your mouth has become really nice and clean. That's when we remove the plaque. Now, plaque itself consists of bacteria, virus, fungal, dead tissues, like from the epithelium inside your mouth, all of that. At the beginning, after we're brushing our teeth, there is a substance called pellicle that form, and then this pellicle is a substance that our body make, and then from that slowly this pellicle is being inhabited by bacteria layer by layer, and then finally, if you don't disrupt that, this bacteria that content in here is a good bacteria, and a lot of them has a good function. For instance, they help in the metabolism, they help with the immunity. They also, there's newest research that actually find out that some of the bacteria that live inside your tongue is help to convert nitrate to become nitric oxide, and these nitric oxide molecules is very beneficial to maintain the blood pressure. We're going to talk more about that. So you can imagine the good microbiome is healthy and is helping us, but the environment in this microbiome can shift it from positive environment to become destructive environment when we eat something, for instance, with sugar or carbohydrates or something acidic. So the pH level in this microbiome change. When that happens, then it invites different other bacteria that live, and then it has negative impact toward this balance, this homeostasis of this microbiome. So when that happens, it called dysbiosis. Okay, so dysbiosis is when microbiome is become more mature, more thicker, is not being disruptive, and then it's with a low pH, and then it's become breeding ground for this bacteria that cause gum disease, periodontal disease, periimplantitis, which is the inflammation around the implants, and also malodor or bad breath. Okay, now with this bacteria, we're going to talk more about the periodontitis periodontitis caused bacteria later on, but we're going to talk about this bacteria that cause these cavities. So what happens is whatever you eat, especially if it's carb, this is sugar, this bacteria eat this basically eat this sugar and carbohydrate, and then the final result of that, they excreting toxin that is acidic. Now, we know that our mouth is has the same composition like your bone. So there is calcium, there is magnesium, potassium, bone protein, and stuff like that. So when you have mineral adding with acid, that will dissolve the mineral. Chicken bone inside the Coke or soda is very acidic. So if you try it at home, okay, put the bone, chicken bone inside this Coke, and then see in 2 days or 3 days, the bones become porous. Why is it become porous? Because the acid is removing this mineral out of your teeth. So that's what happened with our mouth as well. Since this bacteria excreting this acid day in and day out, slowly, our teeth is become weakened and weakened and weakened, and finally it start to get cavitated. That's what we call cavities. Left untreated, the cavities will keep going on and on and on, and then get into the nerve chamber. When that get into the nerve chamber, a lot of people having a lot of toothache. Now, with this toothache, then either there are only two options, okay? Either you do the root canal or you do the extraction. Now, root canal itself is not without risks, and also extraction. So it's better for us to make sure that we cut these cavities early, so we can take care of that and we can prevent the cavities to get deeper. So that's the first option, the first factor why we have cavity, which is biofilm. We're gonna continue on the next program with the other three other factors that cause these cavities. Thank you very much, and look forward to see you again. Bye bye.